consistencies. So I'll kind of go over that with you. So everything that you eat has a different type of consistency, and so some things may be easier for you to swallow, other things may be a little more difficult. So because of protocol right now with PPE and everything, I do have your results on my phone, so I'm going to pull that out if that's okay.
All right.
Okay. Awesome. So, you did really, really well. I'll start off by saying that. So you were able to feed yourself, which is something that I want to commend you on because not everybody can do that when they're leaving the hospital. I know that sounds small, but it is something that, you know, we also kind of look for. You accepted foods really well. So there's different stages of your swallow, right? So we look at how you chew your food, which is what we call the oral stage, how you begin to swallow, which is your pharyngeal stage is what we call it, the fancy terminology, and then a little bit lower is your esophageal stage. So that's more of how it's going down into your intestines and how your body's reacting to the swallow, okay? So for your oral stage, you accepted everything really nicely. There was a little bit of prolonged chewing when you accepted some of the thicker foods, I would say. So the graham crackers, it took a little bit longer to chew them. And that could be because you're on your oxygen, so I know sometimes you get really fatigued and you can be short of breath. So that is sometimes what can cause you to chew a little bit longer. Aside from that, you did really well in that stage. For the next stage, you didn't what we call aspirate, so there were no like overt signs or symptoms that you were choking on anything or that you were having difficulty. There was a little bit of weakness, what we call weakness, in this part of the swallow, but you did really well. Again, there were no signs that we needed to stop the evaluation. And then I kind of wanted to work on some things that might be beneficial for you when you go home, when you're leaving us, okay? So we have some diet recommendations that we'd like you to follow, if that's okay. How do you feel about that?
What are they?
Okay, so they're what we consider soft and bite-sized foods. So that means no big spoonfuls of anything. Yeah, yeah. There was room for improvement, I would say.
Okay. In what way do you think? If you had to do it again?
I think having more time to kind of go over the results, and that's just something that like comes with time, right? Is like being more comfortable with relaying that to the patient versus like me memorizing what I'm gonna say. So, yeah.
I think for you not having any notes in front of you, like you seemed to know his case well. You brought up about the O2 and the COPD, which is a really important element to him and why he's here, because he gets the recurrent pneumonia. One thing you mentioned was you kind of assumed like you're on oxygen, you have shortness of breath, you get fatigued. Like, rather than assuming, you might want to say, sometimes when people have COPD, they can get short of breath, can feel very fatigued. Is that the case for you?
Like ask him.
Yeah. Okay. Yeah. Just to kind of, to not assume and to give him an opportunity to maybe recognize those things.
Okay.
Would you like to provide some feedback?
Sure, yeah. The patient felt very relaxed. You were very, very personable, introduced yourself, was on a very interpersonal level, which was great. That you didn't have any notes or anything, and that you were just kind of like being very conversational. It was just all around very supportive piecemeal of information, so felt that he was in very good hands.
Awesome. Good.
Do you have any questions for the patient?
My heart's like like racing a mile a minute, so I don't have any right this second.
Well, that's okay, that's all right. Do you, before I start something, I think about communication with. I'm a communication guy, so
Yeah.
talk about that.
And I used to be an actor. I've actually done this job. I think it was really good that you use patient-friendly language. Like, doesn't go down the wrong tube. Like, we would say aspirate, and they'd be like, what? You know. So I think it was good because that's, as students, we're not doing that as much. We're still using all the sciencey words mostly. You know, so those of you who switched to that and used a lot. You know, I think that was good that you were able to use words he would understand without talking down to him, which is kind of a tricky thing to pull off. I think you asked questions, you built a rapport. What are your favorite foods to eat? Good thing to consider. Not only these are the right foods to eat, but what do you enjoy eating? Because enjoyment of eating is an important part of our treatment, right? So.
Yeah, couldn't have said it better. Exactly. Yeah, so you acknowledged, like, what are some of the things you've had? What do you enjoy? Like, and then talked about ways to modify that to keep it safe for him. So that's super important. I would say, like, you use the term thicker foods, like, so maybe just considering, like, chewable foods or, like, substituting that, because thicker foods might make somebody think of mashed potatoes or something like that. And with the video swallow, the esophageal, it kind of stops at the esophageal. You know, they check for the emptying. You mentioned like intestinal, but it doesn't actually go that far.
Yeah.
So that would be, you know, just something to tweak with your language. Do you feel like, as Paul, does Paul have a good understanding of what liquids are safe for him?
Yes. I mean, I think if we had been able to do the thickener, maybe that would have been helpful, but I believe she said she'd send me home with information. I think he felt like he knew generally what he could and couldn't have.
Okay, good. And how about the importance of the chin tuck
Yeah,
part too?
certainly.
She showed that, right?
Okay.
She showed that. She modeled that for you, right?
Mm-hmm.
I guess my question to you, Paul, is did you understand when she was describing the video swallow about, because she was mentioning that, you know, this part was good and, you know, she kind of went through. Were you clear on?
I don't think he understood what his specific issue is.
Right, yeah. There's a little bit of lack of clarity in terms of what was the problem then, right?
Yeah.
You were doing so well, and then there was this one part where, so maybe kind of clarifying, like he's a silent, in pediatric therapist, patient-friendly terms.
Got it.
You know, what was going